Years. Hi, I'd like to welcome you all to a discussion, a Q&A with The Only Doctor. And we have in presence the filmmaker Matthew Hashiguchi and the doctor herself, Karen Kinsel. So thank you both for joining me for this little Q&A to find out more about this amazing film. Obviously, advocacy for healthcare for people is foremost in the mind of most of this, and what you, doctor, have done in order to make it so the very poor have a way and access to the healthcare. And I wanted to also ask you, Matthew, how you came in touch with Dr. Kinsel. Was it through maybe the PBS, or was it just your own?
It was a news article on maternal mortality, and that's what I was researching before I had started filming anything, was maternal mortality. Georgia was, I think, in 2018, the worst state in the United States for maternal health. And that's what I was trying to do at the beginning. And there was an article with Dr. Kinsel where she was talking about access to healthcare and how um, various aspects impact our health. And it's not just access to doctors, but it's grocery stores and basketball courts and anything, all these lifestyle options and factors. So I thought, well, I can relate to that. I can understand access to healthcare and living within regions where maybe there aren't as many options as there are in urban areas. And it just seemed like a story that I understood more than maternal mortality. And I called her and she said, come on down. You could, as long as people are okay with you filming, you can film. So I showed up and just kept showing up.
Yeah. Well, it's amazing the people that came into your office, Dr. Kinsel, and your empathy for these people and just how you treated everyone, without judgment, for people. First of all, that's what struck me very early on, is your conversations with these people on, whatever's ailing them. So, tell me a little bit about, I'm sorry to say that some of those people have passed away since this film was made. That was sad to see in the very end of the film. But how have you found advocacy since maybe a little bit more exposure has happened in rural Georgia?
Well, we have a long ways to go. Georgia has actually been designated by Forbes magazine as the worst state out of the 50 for healthcare. And we're about the worst in Georgia. So we have a ways to go. Georgia is one of the 10 states that has not yet accepted Medicaid expansion for adults who are not on disability. And so, like, our uninsured rate in our county is 20% something. And so that's why I've always felt very strongly we need to see everyone, whether they can afford traditional fees or not. So that there are several issues. One is that people need a way to pay for healthcare, and then there need to be healthcare providers there. And you mentioned that your primary care doctor may not always listen to you. That's their job. Yes, they're supposed to listen to you. But we're starting to develop a tremendous shortage of people doing that role. I think Matthew pulled up a number, 20,000 needed now and 50,000 in a few years. Doctors are not wanting to go into primary care, and particularly rural primary care. It's 20 miles to Walmart from here. It's 40 miles to a movie theater. So, it's not, even if you pay people well, they may not be drawn to this kind of thing. Now, but your question was about advocacy. I think I was kind of picked out by people who do PR to try to just demonstrate how ridiculously difficult healthcare is, particularly in rural areas of the state. And it is shocking. It should be shocking. Our governor has already announced that he's not going to allow Medicaid to come into existence next year either. So certainly the majority of Georgians want Medicaid expansion, as 40 other states have had it. And that would really help out people tremendously. I can help them with their primary care needs, but I can't do surgery on them. I can't do a CAT scan on them. And, a lot of the things need that. The governor has come out with a partial Medicaid program where if you're working part-time but still under the poverty level, you would get Medicaid. We have exactly one person in my county who has qualified for this. And so that's definitely not a solution to the problem.
Yeah. Well, and it has the Mercer Clinic been any benefit to those that can pay a little bit more?
Mercer is a medical school here in Georgia whose part of their mission is to train rural doctors. And they opened a clinic several years ago. They haven't had a doctor for the last couple of years. They just started having a part-time doctor last month. They have had a physician's assistant here during that time. And I mean, it's ironic, their specialty is supposed to be training rural doctors. And I think they have 5 openings across their clinics across the state. So, I mean, they have difficulty finding them. And it's not their fault. It's very difficult. Yes, they have taken some paying patients, mostly not my patients. But they really have not helped at all with people who can't afford healthcare. And that's kind of the way the system has always worked. Hospitals charge way too much money, but then they use that to offset the people who are not paying. And that's just kind of the business model. No one else uses that model. I mean, when you go to a shoe store, they don't give out free shoes to some people and nice ones to other people. But that's how healthcare has been funded. And so, I mean, I'm certainly not opposed to them being here and doing whatever they can. I mean, we're still considered an underserved county, even with them being here. The whole area is very underserved. We're one of the poorest congressional districts in the country.
Yeah. Oh, wow. It's interesting, Matthew, with the juxtaposition of those beautiful shots that you have of the lushness and everything of that part of Georgia. It is so gorgeous, and everything. And it's almost like as if that was all that you could see, you would think, and then we get down to really what Dr. Kinsel's doing and and those images of the buildings around in, the clinic. You really see the root of and the poverty that's in there. And I thought it was just really beautiful and at the same time, very real, So how did you decide what was your filmmaking, I guess, plan for that, or, what you thought?
Yeah. Well, it's a beautiful place, and rural Georgia and the rural South is beautiful. Rural America is beautiful. And I think that I've observed and experienced an incredible amount of beauty when traveling to Clay County and spending time there. So I didn't want to emphasize on the dilapidated, decrepit parts, even though that it exists. But it's a beautiful place, and there's a reason why people want to stay in Clay County or rural regions, and it's because it's beautiful and it's generally calm and it's more or less easygoing, and you can look up in the sky and look at stars, and you can go walk along beautiful lakes and rivers. I mean, it's gorgeous. So I think what I observed was a lot of beauty in nature and in people as well, and that's something that I wanted to bring out as much as I could.
Well, it really was wonderful. I it's a very intimate story. I feel like even though it's public with these people, that they, were in there sharing their lives, and we're allowing that to also be filmed. So that was a perspective that we don't normally get to see. So appreciate that they did that and that you all did. There's a lot of humor, I feel like, and even though it can be very, dire in some respects, but when they're talking about putting posters over the wall to cover up, but while they're saying it, while the nurses are saying it, they have smiles on their faces, right? Things are falling down around them in a way. But they still see the good in it. And I think that is a really a remarkable and commendable environment to be in. So that was wonderful. But one of my favorite parts though is when you took down the pillars in front of the clinic, and yet they weren't holding up anything. I feel like there's a metaphor there. It's holding this up, but it's not holding this up.
Yeah, I'm from the north, and even though that was formerly a doctor's office when I first opened up, I've hated those pillars as a symbol of whatever it is ever since we opened. So that was kind of a joyful moment. Um, yeah, and I think Matthew was, well, we all were very fortunate. I don't have any administration over me. So if he had tried to film something similar in a normal clinic, clinic you go to, probably no one would have ever entertained the notion, because they can't deal with anything that's not just part of the day-to-day money making course of business. Everyone we filmed, of course, had given permission. We actually deleted some things that seemed a little too personal, but people, well, and this is really part of the reason why people go to primary care. They want to be listened to, they want to be heard, they want acknowledgement for their suffering, whether that's physical, emotional, whatever. And everyone that was seen was really very happy to participate and appreciated the opportunity. And part of that was Matthew was just very unobtrusive but caring, and that really helped.
Oh, that's great. So I can't not talk about the Star Wars music at your wedding.
My
I'm
husband,
curious about that.
what can I say? He's a good guy, but wasn't my plan. I didn't know about it.
So that was something you were like, what? It's a great moment in that whole ceremony, and especially COVID. And I mean, also that part of the film with the COVID. I've seen things about COVID, but I haven't seen it in a rural community in that way. And especially with the statistic of that being, I think in Georgia, the most affected.
Well, yeah, the first really bad rural epicenter was about 50 miles from here. And actually 3 of the counties that join us were among the top 10 death rates up through that first October. And so, I was sitting at home and people would just call me and say, oh, well, my aunt died yesterday. And, half of the patients in a nursing home in the next county died. And that's really was the last straw for the hospital in that county. So it ended up closing. It was part of all that drama. And, it was just circumstance. We were not hit nearly as hard because we were just another county away. And so the contagion didn't get to us before people started locking down more. We did really, really promote vaccination. I know there's a remark in there about we were the #1 vaccinated county in the state, and that was true for a moment, mostly because we let anyone come to get vaccinated. So we literally had people drive 3 hours down from Atlanta to get a vaccine because we had it, and if you wanted to get it, we would give it to you. The state had not done a very good job of organizing vaccine administration sites and that sort of thing. So there were many lessons learned during COVID. Hopefully we can get better from them.
Yeah. Did you find any resistance from the people in the Clay County to because the way that you spoke to people about it, they were very thankful, but I've seen other things where people are they are suspicious of, what's going on. So
Yeah, I don't think we were any different or probably higher vaccinated within the county than anybody else. Those first people that we called Christmas week, they were all either over 75 or caregivers are over 75. And those people by and large wanted the vaccine. And particularly this was very early on before the disinformation campaign really got out. I think everyone that I called came in. And so we did 60 patients the day before Christmas and the day after. One of those did end up dying. He probably had COVID when he came in. But we did all we could.
Yeah. Oh my gosh. Well, so are you still getting donations to your clinic, or are you still getting some money?
Yeah. Now, and this is kind of sensitive. I had several inheritances in the past year, and so I really don't need money anymore. We do have a nonprofit that accepts donations, and we use it for things like patient supplies, glucometers, nebulizers, that medications, that sort of thing. But we're really not asking for money for the clinic itself. As long as I can continue to practice, I will. It's probably till I'm 75. I actually contracted long COVID in December, and I'm on oxygen some days still, but I'm improving, and don't think that's going to be a long-term issue.
Oh, good. Well, I mean, it's incredible, Matthew, that you brought this to the forefront. Is this going anywhere else? I really was happy to have it be for the, SF Doc Fest, because I just feel like there's a place that people can hear the stories of everyone. And I'm just curious if it's going to be seen other places yet.
Yeah, it just premiered on PBS Real South
Oh,
about a week ago.
awesome.
So right now it's available on PBS, the PBS app, pbs.org, Real South. And then we're talking with some other distributors to broadcast it internationally, worldwide as well. But we've had a really good festival run, and I think San Francisco Doc Fest might be our last festival. So, well, this is one we've been hoping for
Oh, good.
for some time. So we're really glad to be in San Francisco.
Oh,
Well, it's interesting too. We've always had a lot of international contacts. I mean, people in other countries can't believe this is how America functions.
Yeah.
And they're right, but so I hope it is able to get distributed internationally.
that would be
Perhaps that will help move the needle a little bit here.
I'd love that needle to move. And I think that your work and Matthew, you doing this is a step in the right direction to have this happen. So I really appreciate your time and talking to me and to the people who are going to watch this and the film. So thank you very much.
Thank you
Thank you.
so much.
Okay. Have a great bye.
Bye.
Good luck with that storm.
Thank you.
Bye.